Lanisha Yolden, and today is the 1st of November 2018, and I'll just be demonstrating how I perform a discharge following my admission video for a canine with a simple extraction. Hi Hayley, how are you?
I'm good, how are you?
Good, good. So Fluffy went really well today.
Okay.
Really well. Obviously he didn't have any further extractions than that one that we were expecting.
Yeah.
So yeah, really well. So I'll just go through a few things with you prior to me bringing him out.
Okay.
In terms of what we're going to be doing in the future, as well as just some anaesthetic aftercare for you.
Yeah.
So I've got this here for you to take home. It's just a basic outlining of all the aftercare for an anaesthetic procedure as well as a dental procedure, but I'll go through it with you.
Okay.
If you have any questions, just stop and let me know. So really important, what I need from you for the next 24 to 48 hours in terms of the anaesthetic is keeping them really quiet and really warm. As soon as they have an anaesthetic, they're actually unable to keep their temperature up on their own. So we've actually got to do it for them. Alrighty, so no sleeping outside or anything like that. Just keep them really warm and really calm. Also being quite mindful that he is going to be a bit sleepy and not his usual playful self for the next 24 to 48 hours. So not encouraging playful behaviour or anything like that, not going for a walk or anything. Just nice calm environment for him, for that anaesthetic to just wear off for him.
Okay.
Now, in terms of feeding as well, because he did have a procedure today, as well as an extraction, so basically there's a hole in the gum now. So for the next 7 days, what I want you feeding him is just cubes of meat, preferably chicken. So about the size of 20p to 50-cent piece. That's fine. So that's all I want. No rice or anything like that, no biscuits, no mince or just normal soft foods, as that's just going to get in that gum line and start to rot when that closes over.
Okay.
Alrighty, and as well as that he has, we've been under that gum line on all of those teeth today, so it's going to be quite sensitive for him. So we just need to support that recovery there by not giving him biscuits or anything like that. And then when we will see him back in 3 days, just to make sure he's going okay, and just look at that gum and make sure it's healing okay and there's no complications.
Yeah.
And then at that point we can probably talk about going on to a dental based diet, which I'll talk about with you now. So as you mentioned this morning, he's not on a dental diet. Upon the oral examination today, he does definitely chew on one side and he doesn't look like much of a chewer. So is the kibble that he was eating quite small, was it?
Yes.
Yeah, so he's basically just inhaling it.
Okay.
Rather than chewing it. You can definitely tell by those teeth. So now we've starting from the beginning. We have nice clean teeth. We need to keep it like that, so that way he's not having another anaesthetic to clean those teeth.
Okay.
So what I'm going to recommend for him is the TD diet by Hills.
Okay.
Basically, it's a sole diet, so it's a complete balanced diet, so he doesn't need anything else. This has got everything he requires in it,
Okay.
nutritionally. So because it is a dental diet, what it actually does is it needs to coat the whole tooth before the biscuit will actually break. So in saying that, it's actually going to break that tartar off every time he chews, and essentially he's got to eat. So that's probably the best way we're going to keep that tartar off those teeth.
Okay.
And keep that gingivitis down as well. So this is a free bag for you to take home today. Give it a go. Obviously not until that 7 days, and then we can get them onto that. Another thing I really love too, it's pretty new on the market, but it's Oravet. So you mentioned before he has those greenies.
Yeah.
So it's basically like that, except it's got the chemical component as well. I'll just show you. So it's weight based, so this is going to be the one for his weight range here. So basically it's got a chemical barrier as well, so it's basically like mouthwash for dog.
Okay.
So if you give this to him in the morning, it's got that mechanical action of breaking that tartar, but as well as that chemical component. Give it to him before his breakfast, it's going to create that barrier where plaque can't actually attach to that, it just slides right off. If you can do that every day. I recommend every couple of days. Obviously you don't want to do it too much and That's going to be really good for him. It's real low in fat as well, so it's not like it's going to be, you know, pieces of cheese or anything like that. So I'll give you that to go home with as well. We do sell it here. Just let me know how he goes.
Yeah.
So we'll see you in 3 days and then again in 7 days as well.
Yeah.
Just to make sure he's going okay, and then we can look at maybe even booking him in 6 months' time and make sure, see how well this home care diet is going for him.
Okay.
Now, another few things as well, just in terms of anaesthetic, I want you to look out just for some coughing. You can expect it over the 24 hours. It's nothing too serious. It's just an irritation from that trachea tube. However, if it does persist that 24 hours, you need to let us know because that's not going to be normal. Alrighty.
Okay.
Now, he has got a bandage on his right arm. That is to come off when you get home. It's just a compression bandage where we had that catheter today. Now, in terms of bloods as well, everything was within normal limits, so nothing to worry about, especially for a 12-year-old cavalier. That's really good.
Okay.
So yeah, kidney and liver was really good. The vet had nothing to comment on those. And now we've done his nails, his ears as well. We did have a look at his ears. There was no yeast, rods or anything like that in there, so we gave him a good clean out. So that all good to go. Now, did you have any questions today?
No, I think
That's
okay.
it? Awesome. Well, I'll go get him for you. Hang tight. I'll grab your bag for all this as well.
Thank you.
Alrighty.